step into talking about the inflammatory response. Please note that these slides have a lot of extra information because I feel like sometimes it's better to know a little bit more detail, but I'll help you out a little bit and try to write down what my expectations are for your understanding of this process here for the inflammatory response. And really, you'll just have to follow what I'm writing down as far as what you need to remember for this process. So inflammation happens in response to any traumatic event in the tissue, anything. So this, I mentioned this already, like a bruise where you have damaged capillaries, that's actually a traumatic event, and you'll have the inflammatory response there. A minor cut in your skin, a deep gash in your skin, both of them will elicit really the same response, just of different magnitude. Viral infections, bacterial infections, things that you eat that are toxic to you, those all will elicit that inflammatory response. So broaden your understanding of traumatic event. It doesn't have to be like a car accident. It can be something as minor as a paper cut, but to your tissue, that's pretty traumatic. The major actions involved in inflammation, rubor, calor, tumor, and dolor, those are the fancy Latin names for redness, warmth, swelling, and pain. Really, if you just think about it, you get a cut in your skin, you get a scratch, you look at it, we talked about this already, it starts to swell up, it gets painful, you'll see redness at that site of injury, and you'll see, what did I say? You'll see redness and you'll feel warmth at that site of injury. And then you can look at the reason behind this. So this is kind of a simplistic view of inflammation, but we're going to go a lot more deep. So let's look at, or a lot deeper. So let's look at how this whole process works. But first, what are the functions of the inflammatory response? The major functions here, why your body elicits this response, really in response to almost everything that happens right away. First and foremost, to get immune components to the site. This is, again, just imagine you've got a cut in your skin that might have introduced some bacterial species there, and right away you need to get your white blood cells from circulation to that site of injury. So inflammation does that very, very well. Also, a parallel, not completely interrelated, but definitely a parallel response or function to the inflammatory response is repair. So you have damage to your tissue, and your immune system is in large part responsible for initiating that repair. And we'll look at this kind of a step-by-step pathway. And then, of course, destroying microbes and blocking invasion. That should be a no-brainer, but we'll see how that works too. So this is from your textbook, looking at the step-by-step process of the inflammatory response. I'm going to briefly go over it just in just a few seconds here, and then we'll go one by one. So the very first thing is the injury, right? Something happens, and we're just going to use this as our example. You stepped on a rusty nail that had lots of bacteria on it. So right away you have injured tissue, and you also have foreign particles that have invaded in that area. Remember that I said you had tissue resident cells, our mast cells, and macrophages are sitting around right in our tissue, kind of circulating through that connective tissue to try to survey the tissue and see if there's any damage. So right away, when our injured tissues say, help, I'm injured, so they are secreting their own cytokines, then our mast cells also will sense that damaged tissue and also potentially sense the invading microbes, if this is a macrophage, and right away, within seconds or milliseconds even, you'll have the very first thing, which is actually contracting these blood vessels. So the very first second you have vasoconstriction. And the idea here is not completely known, but it's thought that perhaps this is to try to quarantine things right away so that the next step can happen. So before, or to prevent blood loss, and also to prevent pathogens from entering the blood, vasoconstrictions happen. Vasoconstriction happens right away. This is followed immediately by a release of these other chemical mediators, including histamine, which is a vasodilator. So right away is vasoconstriction, but this is followed almost immediately by other types of cytokines, including vasodilators, chemotactic factors, and other chemokines that are involved in increasing the call for help here. So number 2 is the vascular reactions, where you do have vasodilation happening, where you have the expansion of white blood, or the blood vessels here, or the endothelium, which is the layer of cells that are lining the blood vessels. And you'll have the chemotactic agents secreted from these injured tissue that are then drawing these neutrophils to that site of injury from the blood. They seep out into this injured tissue and they respond to those invading pathogens and injured tissue by destroying, just like we just talked about with phagocytosis. This creates pustulation and edema, which is that influx of fluids, and it builds up a very significant fluid exudate in this area. This is edema and pus formation, this step here, which also attracts these late responders like our macrophages that arrive on scene and go and clean up essentially all of that phagocytic debris and help clean up that area. These guys, as mentioned, these macrophages, once they clean up that damaged area, they migrate directly into our lymphatic system, our lymphatic vessels, and head straight to the lymph nodes. You also will have our memory cell response up here right away. These are lymphocytes that may have been triggered because they have already seen this one time around and they're waiting to respond right away the second time. Otherwise, our lymphocyte response would take days to actually become activated if needed. There are other things that are happening that we did not mention. So also in response to injury, we have repair mechanisms at work. So during this influx of fluids to that site of injury, the first step in the repair process is clotting. The initiation is through platelets that aggregate to this area, and then this is followed by blood clotting factors like fibrinogen, prothrombin to thrombin, and fibrinogen to I don't know what it is. So these things all attract to this area and form a deep fibrous network to create that blood clot. And this blood clot will form both here in the damaged tissue, but most predominantly here in the damaged blood vessels too. Following this blood clot will be scab formation. This is a temporary fill where we have all of these, and I guess this would be blood clotting factors, and this would be platelets to scab up that area. And this would be followed by reorganization of fibrous tissue to form that scar there. So with all that, and that didn't take a few seconds, sorry, but let's look at this a little bit more step-by-step fashion. Again, the very first thing, we have injured tissue, and our mast cells and tissue-resident macrophages will release a whole bunch of different things in response to this. So let's go and take a look. I'm going to draw this out for you. I think I'll just draw it out in Microsoft Word. So let's create a new file where we can just write the process of inflammation.
Please keep all bags and personal items with you at all times, and inform airport personnel of any unattended bags or suspicious behavior. Do not accept packages or other items.
So we have injuries, we have damaged tissue, and we have our damaged tissue secrete what you can generally term danger signals. And these are sensed by macrophages and tissue resident macrophages and mast cells will respond, right? And specifically these mast cells will degranulate. And the very, very first reaction here is vasoconstriction to prevent blood loss and to quarantine or prevent pathogens from escaping into tissue. So this is very first and foremost right away what's happening, but this is followed almost immediately by our the next response, which would be vasodilators and chemotactic factors. So the other types of molecules, right? So other cytokines. We have chemotactic factors secreted by both macrophages and mast cells, and chemotactic factors are responsible for setting up a chemical gradient that attracts other white blood cells, white blood cells like neutrophils right away. and other white blood cells following. Right, so these chemotactic factors are secreted, and their job is to set up that chemical gradient. They also help modify the blood vessels there, and one of the effects here of other types of cytokines are vasodilators. And an example of this would be tumor necrosis factor alpha, as we mentioned before, is a great vasodilator that's secreted by these activated macrophages and mast cells that are there. So let's look back over at our image that we're talking about. And again, so these mast cells that are there will secrete these cytokines. These are more than you need to know, but if you're interested in the particular types, histamine is a vasodilator secreted by these mast cells. Interleukin 6 and interleukin 8 are types of chemotactic factors that can help draw neutrophils to that site of injury. And then there's a couple of growth factors that are secreted here as well. So heparin is an anticoagulant. This is important in preventing coagulation of blood right away so that we can actually get white blood cells to the site of injury. But then we have also a repair mechanism, vascular endothelial growth factor, that's secreted. Vascular means our blood vessels. Endothelium is the layer of cells that are lining that blood vessel, and growth factor. So as hopefully you can put the pieces together, but this growth factor is secreted right away to begin the reparation of our blood vessels. Again, we have those tissue resident macrophages that secrete cytokines as well. They have chemokines that they secrete and vasodilators. The chemokines function to stop white blood cells in the blood and then create that concentration gradient so that neutrophils, macrophages, dendritic cells, and even some lymphocytes can arrive on scene. And then also these vasodilators, interleukin 1 beta and TNF alpha, are really common ones that are secreted here. There's a whole bunch of others. It's a very, very messy situation that's happening there, but their jobs are really roughly the same: to draw things to that site of injury and to open up the blood vessels so that things can seep out of the blood and get to that site of injury. So next we have the vascular reactions. So what's happening to the blood vessels, as we mentioned right away, is vasoconstriction, but this is followed immediately by vasodilation. Vasodilation is important because things need to get from the really tightly lined blood vessels and somehow get out into the tissue. This is an unnatural process, but vasodilators allow this to happen. There's a very particular migration of these white blood cells from the blood into the tissue. When fluids and blood get out, seep out from the blood vessels into the tissue, we call this edema, which is fluid buildup in a particular area. And the process by which white blood cells get from the blood into the tissue is called diapedesis or extravasation. So we've written that up here. So vasodilation causes the influx of fluids again, getting white blood cells from the blood vessels seeping out into the site of injury following that chemotactic gradient. This is a picture of this concept of extravasation or diapedesis. Here we have our blood vessel. Again, it's lined really, really tightly with these closely connected endothelial cells. When there is an injury response and our mast cells and macrophages are secreting both those chemotactic factors to create that gradient for chemotaxis, and also those cytokines like oh my gosh, my brain stopped working. Histamine, cytokines like histamine can go and bind to these endothelial cells, and the binding will cause them to change their cytoskeletal arrangement and actually change their tight junctions here between them to make them a little bit more leaky. And this leaky factor allows these white blood cells that are normally rolling through the blood vessel, we call these rolling white blood cells, or rolling leukocyte adhesion. So these guys are sort of rolling along and they're waiting to or trying to sense any kind of injury signal. And so at that site where they actually sense that injury signal, they will essentially adhere to these epithelial cells and seep through the lining of these endothelial cells and migrate then through the tissue to that site of injury. This is a transmission electron micrograph where you actually see neutrophils squeezing their way through these junctions between the lining of our blood vessels here. So here's one example here, another one as it's squeezing its way through. and kind of pouring itself out the other end. It's quite an amazing process that these guys can do. And again, to just show you one more time, this is from an advanced immunology textbook, but I do like this image to show you a couple of these factors. So white blood cells, if you look at the flow of blood through these blood vessels, you'll actually find that white blood cells, they don't just flow through like red blood cells do. They actually roll along the edges of your blood vessels. That's just what they do. And they do it because they have these particular things called integrins that are these sticky molecules. They have them in low abundance that are on the surface of their cells. And these integrins, their job is to bind to these integrin receptors over here that are on the surface of our endothelial cells, and it just sort of keeps them aligned with the side of our blood vessels, so that if there is a response, or if there is an injured tissue response down here, these chemokines and cytokines can be sensed by these rolling white blood cells. If these white blood cells did not have these, they would just be flowing through like red blood cells, and it would be very, very difficult to get them to stop where they need to stop and migrate through this endothelial lining. So this is sort of how it happens. You'll see that our endothelial tissue, these cells do have these adhesion molecules, but they have them in really low abundance. So there's just kind of this little high five that they do in passing, and it really just keeps these guys sort of localized in this area, but it doesn't do much else. Now, when there is an injured tissue response here, these chemokines create this gradient, but they also, some cytokines also change the nature of our endothelial cells to increase the amount of sticky adhesion molecules they have on the surface. So whereas normally you just find a few of these little sticky molecules here and there, at that site of injury, the endothelial tissue will have tons of that sticky adhesion molecules on the surface, and these rolling white blood cells will be arrested right at that site of injury. And once they're arrested, they have the ability then to bind to those chemokines that should be at that same site of injury, and this binding will elicit a response, which is that diapedesis or extravasation, where this white blood cell will squeeze through the dilated vessel here and then follow that chemotactic gradient to that site of injury. All right, so going back to our list here. So for, So we have, after that immediate reaction, we have our vascular reactions. And this is where our cytokines and chemokines create that gradient, and we have vasodilation from cytokines released above. This makes the blood vessels a lot leaky blood vessels. Right? This also, as mentioned before, creates changes in those endothelial cells so they're much more sticky, so our rolling white blood cells will stick to that area. We have a chemotactic gradient formed that will draw white blood cells from blood to tissue, and then this process by which the white blood cells migration is called diapedesis or extravasation. Both of them mean exactly the same thing, the movement or migration of these white blood cells from the blood seeping through that leaky blood vessel into the tissue. This causes a